Namaskar, you're watching Doctors Chat, our special series on COVID-19 live on DD India. I'm Sakal Bhatt. Well, India has begun giving booster doses of the COVID-19 vaccines to priority groups amid a surge in infections. Health and frontline workers and people above 60 years old with comorbidities are currently eligible to take the jab. The drive began today as India battles a spike in COVID cases fueled by the Omicron variant of the coronavirus. In fact, early studies from other countries have also suggested that a booster vaccine may provide more protection against Omicron. The emergence of the Omicron variant of COVID-19 has led to serious concerns among governments, amongst epidemiologists across the world. But also, according to the WHO, Omicron is a highly transmissible variant, more transmissible than the formerly discovered Delta variant. In fact, WHO maintains that despite the higher transmissibility, the Omicron variant caused milder symptoms in those testing positive for it. However, one of the most striking findings made by WHO reportedly is its impact on vaccine efficacy. Today on the show on Doctors Chat, we get a sense about the efficacy of booster doses and precautionary doses and also understand the difference between the two. We kind of get more clarity on the eligibility criteria and the kind of vaccine policy that is in place for near future. What really decides who gets booster dose or precautionary dose? Dr. Vikas Bhatia, very glad to welcome Dr. Vikas Bhatia on the show. He is Executive Director and CEO AIMS BB Nagar in Hyderabad. Thank you so much, Dr. Bhatia, for taking out time. First things first, how was the response? Namaskar. First things first, how was the response to the day one of the booster dose campaign?
I'm really delighted to share my happiness because in the morning when I went to the AIMS, my doctors told me, sir, please come. A lot of our frontline workers, nurses and doctors have come, and many senior citizens have also come for the vaccination. In fact, they all were waiting for this day. And this is the one thing which I saw in the morning, but I know the same enthusiasm, the excitement must have been all over the country. People were waiting, deliberating, talking, and discussing on TV channels and everywhere. So finally that wonderful day arrived when all the frontline workers, health workers, and senior citizens, they came forward for the vaccination. I'm really happy to share my delight with you.
Okay. Now let's understand the difference between the booster dose and the precautionary dose, and sometimes we also use the terminology additional dose. A lot of people are saying there's not much clarity what really is the difference between the two and the eligibility criteria.
See, it is booster dose or precautionary dose, whatever you want to say, that's fine. At the end, the third dose has to be given. It's primarily the third dose which has been given. We call it precautionary because we are giving to the citizens and youngsters as a precaution. When we talk about the booster, if we go in the immunology or as an immunization program, when we know that the primary doses have been given, and now after some time we give the another dose to boost the immunity. We call it the boosters. However, that takes a long time and research.
Okay, we'll try and reconnect with Dr. Bhatia, but in the meanwhile, what is the eligibility? All right, he's with us. Go ahead, sir.
We do not have so long a time to, So we are now giving the third dose, and Prime Minister Saab, he mentioned that this is a precaution dose because we want to take more precautions in prevention of the COVID infections or hospitalization.
Prevention and hospitalization. According to the WHO, it says Omicron symptoms obviously are milder than its previous variant, the Delta variant. It also says that it may reduce the efficacy of existing vaccines. First of all, if you could just explain that a little further. And what is also a little alarming or perhaps a little strange is also in the official brief, WHO also says that the Omicron variant causes, and I quote, a reduction in vaccine efficacy against infection and transmission.
See, we are into the almost 6 weeks of this Omicron infection. Time in South Africa on 12 November last year, and so it's not too long, and but it has spread all over the world, and particularly we have a lot of information from South Africa, from European country, Australia and US, and there's one observation which has come is in comparison to the Delta virus, it is definitely mild because a lot.
All right, let's try and reconnect with Dr. Bhatia. Okay, there seems to be a bit of a network issue out there, but
number of infections, the carriers, they have the organism, the virus, but the mild group where there are most very early symptoms like cough and cold and maybe very mild fever. Now, as far as efficacy of vaccine is concerned, you were asked about it.
Yes,
there are no clear evidences that the efficacy has really come down because of the previous doses. But it is in general, as immunologists, as epidemiologists, we understand that with different vaccines, as the time passes, the efficacy comes down. Another factor which has come in play is that there is a mutation. There is a difference in the structure of the Delta virus and the structure of the Omicron. So when there is a change in the structure, the previous vaccine, the vaccine which has been given is developed on the basis of the previous virus structure. Now, since there is some change in the structure, mutation has taken place in the S protein, it can be said that there will be some decline in the efficacy. But nonetheless, it is still very efficacious. It has been able to reduce the hospitalization. It has been able to reduce the ventilation, patients on ventilation, or even as it is replacing the Delta virus, Omicron is becoming the dominant virus. It has been observed the death rate has started coming down.
Okay, so advocating booster shots, would you say we must advocate more booster shots because it increases vaccine efficacy against this particular variant?
Yes, I agree with you and with the government's decision and the global, vaccine program is going on all over the world, particularly in the European country and in various other advanced countries. The booster dose has been found to be efficacious. It increases the antibodies in the overall, and it has been observed that there are different vaccines being used like Pfizer or Moderna or Sputnik in many other countries. It has been observed that the antibodies levels, they come down after a few months, and we have one of the good examples is Israel, where the vaccination started too early. That's like in October, and they completed the vaccination with 2 doses in the country. But sometime later, they found that a couple of months later, they observed that the number of cases of COVID and started rising, and they started with the booster, and it suddenly came down. That is the direct evidence that how the vaccine is working very well. The second very strong evidence which has emerged from all over the world, particularly those countries where it is being given, that the hospitalization and the mortality is definitely very low in comparison to in unvaccinated patients or individuals, in comparison to those who are unvaccinated or who have taken.
Okay, so countries that have started booster doses,
a single dose. So there is a clear evidence and there is a science.
Go ahead, sir. Go ahead, sir. We're facing a bit of a technical snag there. I think the connectivity issue. Please go ahead.
Right. Yeah, I'm fine. You can ask another question. I've responded to the question. Uh, the booster doses or the precaution doses in India, which was very much being deliberated, now it is being rolled out in phased manner, and different groups like the teenagers in the age group of 15 to 18 years, and also the elderly, which is a high risk group. The precautionary doses are being given throughout the country, and there is a very positive and very strong response from the community.
Why was then there of late some sort of debate revolving the eligibility of the precautionary doses? I hope those apprehensions and speculations have been put to rest permanently. The vaccines that are currently available with India are absolutely robust, and their efficacy on Omicron is non-negotiable, would you say?
Definitely, there is no scope of the compromise, and in fact, the different countries develop their own vaccines, particularly UK, US, and Russia, and China, and India, and we are very proud of our nation that our own our own scientists, they developed a co-vaccine in a very short period, and and we are manufacturing Covishield in our own country, and the efficacy which has been observed to be quite good. Another important aspect which we have to take in consideration is the AEFI. That's what, in simple language, we say the side effects or the problems which may
some of the... Yes, I was coming to that question, sir. Side effects, yes.
Yeah. So that's what we have observed. The Covishield and the Covaxin, which are the dominant or the prominent two vaccines being given in our country, both of them are very safe. And the Covaxin is all and that's what we have seen in our nation. Yeah.
Yes. Another matter of not really debate but concern has been, in fact there have been questions, what about the clinical trials for the booster dose? What would be your response to that?
See, the entire vaccination program is based on science, and without the evidence or without the clinical trials, no government will introduce them. World over, it has been done, and the same vaccine like Covishield we are using is being used in UK also, and we are using the same vaccine, and also in parts of the Australia also it's being used. So it's found to be very safe. So clinical trials have been done in our country in various institutions in the very early days. Also it has been done, and also with the Covaxin also. Trials have been done. So the initial results have been promising, and even the WHO also has given approval and recognition to both the vaccines, including the Indian vaccine, the Covaxin. So there is no chance that the government will just start like that. The trials, clinical trials have been done, and the data is being gathered. Even every day, thousands and thousands, in fact 70, 80, 90 lakhs of vaccines are given every day, and we can see that they are very rarely some side effects are there, and most of them are very mild in nature. Very rarely somebody may have some issue, but otherwise in general it's safe.
All right, we can just play some play out those latest COVID count graphics for our viewers, just to understand where we stand in terms of numbers and how numbers are stacked. But Dr. Bhatia, that point on gap between the second dose and the third dose, A, B, mixing of vaccine. So if one has gone, okay, first point on the gap.
Maybe. Is it fine?
Yes, go ahead, sir.
Can you listen to me?
Yes, please go ahead.
Are you able to hear me?
Yes, we can hear you. Go ahead.
Yes. Yes. See, every country started the vaccination program according to their decisions, according to the availability, and according to the emergence of the COVID infection and or pandemic in the region. If you see in India, it was introduced and or launched on 16 January for the healthcare workers and the frontline workers because they were at the highest risk. Subsequently, the government decided to broaden the horizon and make more beneficiaries, and was increased, given to the 60 years plus, and also the 45 to 60 years with having comorbidities. And subsequently, on 1st May, everyone above the age of 18 years, all adults were given the vaccination. Now, if you see the vaccination rate, you will find that in the early months, only these selected people only a group of people were given vaccine. The supply also increased, the maximum vaccination took place in the month of May, June, July, August. And when you go for the second dose, which is a couple of weeks away after the first dose, like 12 weeks, which kept changing in between. If you take 12 weeks, then you can say that with the 2 doses, the maximum number of people who got vaccinated were like in the month of August, September. So in a way, in India, a large proportion of population got vaccinated somewhere around this time. When we see the global data and global discussion on this, we find that the immunity started declining after 5, 6 months, 7 months. Some countries started at 5 months, some started 6 months, some started 7 months. So according to their requirements and needs. So if you see that group of population, they are yet to cross that period. The government's decision to start with the vaccination program for the frontline workers. I went to the immunization clinic today in my COVID vaccination. When I was to give discussing with my colleagues there. Many of them have taken in March, April, May their second dose. So we are not
All right, so we're trying to get more clarity.
This season has been too late.
Okay, go ahead, sir.
Yeah, so which means that the government has taken a decision that 9 months will be the period who after the second dose. So that is the earliest possible because I took first dose on 21st January and the second dose somewhere in the last week of February. Today I have taken the booster. So it's nearly 9 months or so. That's perfectly all right. So within a couple of days, my body will have more antibodies and I'll be stronger in fighting against the Omicron and particularly at least from not getting hospitalized.
Okay, yeah, that's a very important point. And sir, you've explained quite comprehensively the gap between the doses. Now, the choice of vaccine, there's a lot of emphasis that there should not be any mix and match when it comes to second and third dose. If you could just explain and the rationale behind it. If one has gone for Covaxin or Covishield in the first and the second dose, so the third dose has to be the same as first and second, right?
Right. No, it's now you I have any on evidence, and then we have seen the efficacy has gone that way. There have been few studies which have been done in some pockets or some very small samples. So we have seen in different parts of the world that the mixing can help. That will be beneficial, and I agree with this that there is a possibility that the mixing of the two
so mixing
will be a good possibility.
So just a sec. So mixing as in what? Like obviously my 2 rounds of vaccine, my first 2 vaccinations will be a single vaccine, right? If I've gone for Covaxin, the second will be Covaxin. So when I say mixing, I mean for my precautionary / booster dose. Do I have to necessarily go for Covaxin or I can opt for Covishield?
This is a very clear decision which has been made. I was coming to that point only. Now, if someone has taken 2 doses of Covishield, the third dose has to be taken as Covishield. That has been taken by the government. If somebody has taken 2 doses of Covaxin, the booster or the precautionary dose has to be Covaxin. We are not going to mix up. It's not that we are mixing two together and giving. That's not the point. The point is,
so
the first 2 doses and the dose has to be the same vaccine. If it is a Covishield.
Go ahead, sir, please. Yes, go ahead. Go ahead with your answer.
Yeah, and then if we have given the 2 doses of Covaxin, the third dose will also be Covaxin. So we are not making any, experiments or until we have a good, scientific data with us that it is really very, very beneficial because otherwise it can create confusion. And in case someone gets some reactions, the program may get setbacks. So there is no need to do those kind of experiments on without a very, very strong evidence within our country. So that's the decision which has been made by the government. I think I agree with this. So the response in other country also has been found to be good when the same be given and there is no mixing.
Yes, there have been cases, Dr. Bhatia, people have contracted infection despite vaccination, complete vaccination, and they've been found second time positive.
Definitely, that I would like to explain to you in based on the science.
Sure.
In 2 ways. One is there is no vaccine possibly to my understanding which gives the 100% protection, right? And the program, the vaccination program, the universal immunization program, which has been implemented since 1978, and a lot of vaccines are given. So no vaccine is there which gives the 100% protection, and that's the reason even the government introduced the second opportunity for the measles also, so that with the 2 doses the response will be much better. It will be closer to the 100%, or it will be between 90 and 100%. So that's the similarly. Some people may not respond to the 2 doses of vaccines, which we expect that if they get it, that's the perfect situation. There can be few reasons, like many of the people may be immunocompromised. Many of everybody has got a different genetic composition. There may be exposure to various kind of viruses in the past, or there can be the immune response of the individuals. How it happens? That's the reason that some of the individuals they are getting the infection despite the vaccination.
Okay, Dr. Bhatia, can you hear us? All right, let's try.
But at the same time, the second point is, or the previous variants. Now we have the Omicron, where there are few mutations, which has been reported to be more than 50 as such overall. Or if you take the spine as protein, then about more than 30. So there is a possibility, but at the same time, what are we looking for? We are not worried about infection as such, or cough or sore throat. What we are interested is that patients should not get admitted in the hospital.
Death and hospitalization is what we are looking for.
Patient should not be getting efficiency or the
in terms of prevention
level, doctors and people should not die. We want to save that.
Yes. So, first of all, our apologies. There's a lot of connectivity issue we are facing today, but nevertheless, you've managed to explain us in great detail. Dr. Bhatia, one last final word from you, sir, on this show. Third dose policy, generated a lot of debate, but at the end of the day, it seems everything is falling in place in terms of more clarity as to what the government's vaccine strategy is going to be all about, spread across many months and years and so on and so forth. Would you say Corona is here to stay for some more time, but we are at it in terms of more vaccines in our kitty? As of now, we have given nod, government has given nod to 2 vaccines in terms of the additional dose, that is your Covishield and Covaxin. But what is expected in future, sir, in terms of more vaccines with us?
Yes, I think first of all, we should appreciate and congratulate all the scientists that we have been able to develop our own vaccine. Just think, go to the past about the HIV. For so many decades, that disease was existing. We still do not have a vaccine, but we could develop this vaccine within a short period. That's a very big achievement for us. Now, another big achievement is we have another 2 or 3 vaccines. A lot of studies are going on, a lot of work is going on. Another 2 vaccines are going to be introduced, and there will be more options which will be available with us. So definitely, we'll when we have the more evidences, and we have the comparison, we'll come to know that which vaccine has got the best response. That will come to know in few months from now. And as far as the Omicron or the COVID is concerned, what's going to be the future? What's going to happen? I feel that that's my opinion as I guess as an expert in this specialty in this area. That in India. Cases. A large number of infections are being reported, a lot of number of cases are being reported. Our main concern is that if they are too concentrated, then even if it's a small percentage of that might burden our hospitals. So what is the best policy is that as much as possible, instead of everybody getting exposed within 6 to 8 weeks or 2 or 3 months, we should make an effort that it is spread over a bit of a longer period, maybe 4 months, 5 months, so that there is our beds are not overburdened. The hospitalization is manageable. So that's the focus. And I can feel that when the vaccination in our country is more than 90% adult population and 65-66% have already taken 2 doses, and more people age groups and more hearts are being given. Already, a large seroprevalence has been reported in our country, so that hybrid immunity is also going to work very well for our fellow citizens, and newer vaccines are also there. So I feel that it's a fight between the Omicron and the Delta virus which is taking place, and as the Omicron keeps dominating and the Delta will disappear, the possibility of the mortality will is there, that the possibility of the mortality rate will come down. So in days to come, in weeks to come, I hope and I pray, my feeling is that the summers of this year, we should be in a better situation. And by the end of this year, we should hope that the COVID should disappear from the world. Of it all, flu which is being reported in different parts.
All right. On that very, very positive and assuring note, thank you very much, Dr. Bhatia. It was such a pleasure talking to you, sir, and understanding in great depth the difference between precautionary booster, the efficacy of it, and the importance and the very rationale behind the eligibility criteria. Thank you for joining us live. And with that, it's also time to take your leave, but remember, we're going to be back very soon with fresh episode of Doctors Chat COVID series special. Meanwhile, thank you so much for tuning in to DD India from me and my entire team of Doctors Chat. Thanks for tuning in. Take good care of yourself. Masking, frequent hand washing, social distancing is must. Namaskar.